He's our hero.
But you don't remember, John. You don't
He's a hero, not a criminal. Saved my life.
He's over there. So I guess
people might need to.
Really deep in my heart, I'm so thankful to Dr. Wong because of him. I get better because I get the special diet that the government and the ODSP take it away.
I went to Dr. Wong because I didn't have a doctor, and I needed the special diet to literally save my life. I was sick, and I was on death's door. Dr. Wong signed that form for me so that I could live and be here today.
My name is Philip Berger. I'm a physician at St. Michael's Hospital in Toronto. There's a few things you have to know about the college decision. One is that Dr. Wong did not harm anybody, did not make anybody sick. He was just trying to give them a little more money so people could achieve a minimal way of living and have enough food. Well, there's a surgeon that a case was reported on who had an infection that she was treating herself and going to the hospital and putting the entire hospital and the patients at risk. She got a 3-month suspension and a $4,000 fine. Dr. Wong gets 6 months for hurting nobody and a $35,000 or more fine.
Shame!
Shame!
And believe me, the college is sending a message to two groups of people. One is to doctors who are trying to help poor people, and they're telling those doctors, you better interpret the rules as strictly as possible, and you better err on the side of favoring the government, not your poor patient when they're asking for more money through the forms.
There is a great need to change, and physicians should stand up that this college has not done its work. It has a humongous conflict of interest. Physicians tend to be quiet. They say, well, we are helping people. We do not want trouble. And that's what has happened. And when you do not speak up, you'll be bullied. And physicians have been bullied in the past and now, and in my case. 6 months penalty for helping the poor. I would ask you, do I deserve it?
No! You're our hero!
My patients, I really feel sadly for them. A patient came to me, he has lung cancer, he has a hole in his chest, and he said to me, if you give me so much narcotics because I'm coughing so badly, won't they give you trouble again? I mean, just imagine this man who's dying. He would say to me, please be careful because they may get you again. I says, I'll have to take the consequences. This man is coughing, and sadly, I will not see him again when I go back to work. I will not see many of you when I go back to work because some of you may have passed on. And that's the nature of the 6 months penalty. It is not an innocent penalty. This is a penalty against my patients.